So I have a question for you. Have you ever been so incapacitated with fatigue or pain for such an extended period of time that you can hardly leave your home or your bed for days, weeks, months, or even years? I hope not. I hope that nobody in this room has had that experience, because it's really not a nice experience at all. But there are literally millions of people around the world who right now are in this situation. So my wish for you today is that you will learn how that because many of these chronic conditions do not actually have a physical cause, and that the answers are actually here right now, even though a lot of people are still saying we're still looking for an answer, that the solutions are here now, and many people are able to be helped right now and have already been helped right now. And my wish is that this information can be spread to a wider audience. And I want to share this quote, which I have on the back of my business card, because this is really where we're at in our healthcare system, and you could say in many areas of life, is that sometimes when something new comes along, just as, you know, Galileo, was it, who said that the earth was flat and not round? You know, truth does pass through various stages, and it is opposed sometimes initially. So if some of what I say today falls in that category, I invite you to have an open mind. And one of the things I learned many years ago from one of my teachers was we treat people, not illness. So in the USA, it's estimated that there are between 1 and 2.5 million people with these chronic fatigue conditions, and in New Zealand, 20,000 upwards. This is quite an old statistic actually, from 2011, so it may be many more now. And 40 million people diagnosed with IBS in USA. So massive numbers of people suffering from these chronic conditions, which really disrupt their life. And just in September, there was Millions Missing Day, which is a series of not protests, but gatherings around the US from different cities of people whose lives are missing due to these chronic conditions. And the good news is that solutions are here now. So why me? This was my own personal journey back to health from 25 years of chronic illness, including not being able to work for 10 years, trying nearly 200 therapies, nearly giving up at one point, selling my house, traveling around the world to find answers, which I found, and then I started training in various therapies and really working with people with these chronic illness conditions. And I started exploring telehealth in 2009. And the problem is with the people with these chronic illnesses, as you can imagine, is that often they're too ill to travel. They can't even get out of bed, they can't walk, they can't drive, and so it's very difficult for them to get treatment. Also, the distance from a practitioner may be, you know, out of the question. And also a lot of the methods, but in particular the methods that I'm using, they're not that well known. They're not really integrated yet into the mainstream medical system, and that's one of the things that I'm very passionate about, is bringing together these sort of healthcare methods and integrating them together. It's not an either or, it's we need everything. And another problem, as I mentioned before, is that the cause of these illnesses is not to be found at a physical level. It is metaphysical, meta just meaning beyond. And the consequences of this is that people stay ill for years, and even worse than that, they just lose all hope. They get very desperate, hopeless, there is nothing to look forward to, depressed. It is not a happy life. And of course, from a governmental, nationwide point of view, it's a huge drain on finances. So how do remote consultations work? So let me give you the example of my very first remote client. She was 75 years old, and she rang me up, and I said no the first 2 times to remote phone consultations because I'd never done them before, and I really felt like, no, I have to see you face to face. But on the third call, she just was so such a lovely lady, and she really wanted the help, and I thought, I've just got to say yes, I've got to give this a go. And right from the get-go, from the first session, I knew that it was going to work and that it was going to be equally effective talking over the phone with somebody, because this was sort of pre-Skype at the time, and she was very happy with it. And at the time when we had our first consultation, she was unable to hardly get out of the house, and so we started with these phone sessions. So she lived in Whangarei, which was 3 hours from where I am in Auckland. And the first step is explaining through the protocol that I have learnt and been trained in what causes illness, and the link in particular between stress, suppressed emotions, past emotional trauma, and what is going on in one's life currently that is putting the body into this state of dis-ease. And what I've noticed over the last 11 years, and it really became apparent to me probably after about 5 years, of these recurring themes for people with these chronic illnesses. And what I saw was that the very first 7 to 10 years of life set up the foundation for illness later in life. And what happens is people have certain events and traumas and stressful situations that happen when they're a child, before the cognitive abilities have really developed, and they don't know how to deal with these issues. And it sets up emotional trauma that is stored in the body, but it also sets up certain unconscious limiting beliefs, such as, oh well, I won't be loved unless I'm a good girl, or something like that. Or if the parents are fighting and then the father leaves, the parents divorce, and it's like, well, men that I love leave me, and so therefore I will try and get the approval of people in my life, and I'll always try to be proving myself to get the love that I want. Therefore I won't speak my truth, I'll hold everything in. So it creates these unconscious behaviors that then lead us to get absolutely exhausted and ignore our own needs. The next step is, okay, well, what do we do about this? How do we reverse this? And so what she was taught to do was how to make herself a priority and put herself first without feeling guilty, to let go of past hurts, to be her authentic self. And as she did this, the frustration and the sadness and all the pent-up emotions start to release literally from the cells of the body, and the pain starts to reduce and the tiredness starts to reduce. Now, just as a sidestep for myself, I had chronic fatigue, and I was unable to work for 10 years. And the turning point for me was when this therapist that I went to, who then became my teacher, said to me, chronic fatigue is not a lack of energy, it's blocked energy. Nobody had ever told me that before. I thought I had no energy. Actually, I had masses of energy, but I was blocking it all, and I was specifically blocking my emotional energy. And once I learned that, and I started to learn how to get in touch with my feelings and process my feelings, my energy just started to come back immediately. So I know it can sound sort of strange, this connection between emotions and symptoms, but actually there's a very, very strong connection. So within 2 months, she was 90% symptom-free, able to drive again, and she actually moved down to Christchurch to be with some of her other family, which she'd been wanting to do, but she'd been too ill to do. So when I started in 2009, it was all face-to-face. Then I started getting inquiries from around New Zealand, and then I started getting inquiries from all over the world. And now 100% is online. I don't have a clinic anymore. And also put together in 2011 a multi-speaker summit on chronic fatigue and fibromyalgia. And since last year have created, sounds a little similar to Melon Health, self-directed home study courses. And there's an example of one of the modules with the different lessons. Didn't have time to show you more than this. But they click on a lesson, and there's a video of me talking, and they can watch the video, download the MP3 so they can listen to it offline, download the PDFs, review as long as they want. So self-care is about putting patients at the center of their healthcare, and that is absolutely my passion. There's nothing I love doing more than empowering people to take control of their health. And to me, that is ultimate healthcare. So I call it self-care, a revolution in healthcare.